Cognitive Behavioral Therapy. The Complete Guide to Overcoming Depression. Master your brain and emotions to overcome anxiety, depression, and negative thoughts. Keith Noland. Chapter 1. Why use CBT? Cognitive Behavioral Therapy, CBT, aims to improve your general mental and emotional state with the use of a practical approach. It helps you understand complex and challenging cognitive distortions in your thoughts, feelings, and attitudes to improve the ability to function and the overall quality of life. It was designed initially to treat depression and other mental illnesses, but it is now being applied extensively in the treatment of various psychogenic problems, ranging from sleep disorders to drug and alcohol abuse, depression, severe mental illness, eating disorders, and anxiety. By paying attention to beliefs, attitude, and lifestyles, it aids you in identifying thinking patterns responsible for ineffective behavior and negative moods. Identifying these patterns improves your emotional control and helps you to develop coping strategies against emotional difficulties that lead to depression. CBT also features an essential advantage over several other treatment methods. It is a short-term treatment compared to others. For most emotional problems, it has a treatment plan ranging between 5 to 10 months. It features a smaller amount of sessions per week, each lasting for approximately 60 minutes. During the sessions, you work with the therapist to identify the psychological triggers that impede typical day-to-day function. Throughout the therapy sessions, the therapist introduces several techniques that can be applied when the need arises, and these principles can be used over a lifetime. CBT is based on the principle of the addition of behavioral therapy to psychotherapy. Behavioral therapy focuses on the role our problems play in affecting our thoughts, behavior, and general lifestyle. Psychotherapy pays close attention to the beginning of our thinking pattern in childhood, and how the importance we place on things affects our response to them. It then aids people in challenging those automatic thoughts, reactions, or beliefs that come when triggered by specific situations, using appropriate strategies to modify their behavior to more positive responses and thought. The history of cognitive behavioral therapy. Aaron Beck is credited for inventing cognitive behavioral therapy in 1960. He was a psychoanalyst, and while in analytical sessions, he saw that his patients had conversations with themselves, similar to those between two people. But his patients never gave a full report of their thoughts. For instance, during a session of therapy, you might be thinking to yourself, the therapist, doesn't understand anything I'm saying.
Sample complete. Ready to continue?